Epilepsy is treatable. If your child has epilepsy or if somebody in the home has epilepsy, please seek medical advice. Do not hide this person in the home. Epilepsy is not a disease which is transmissible from one person to another. In the community, there is this perception that if a person has a seizure and the saliva touches you, you'll get epilepsy. No, it is a disease of the brain in which you have an abnormal discharge, and nobody touches that electrical activity. It is in your brain because there is an abnormal connection in that brain, which tells you that many of the causes of epilepsy are preventable. I had already indicated that around the world, only 1% of the population, 1 out of 100 people has epilepsy. But in Uganda, our burden is much higher. In some places, it's more than 2%, and the reason is these preventable causes. So, please, for mothers who are expecting babies, attend antenatal care so that diseases are easily prevented. Deliver in hospital so that you receive care from a trained health worker. After birth, let your babies receive vaccination. Now we even have malaria vaccines so that young children do not contract severe malaria. When they get cerebral malaria, 10% of the children who get cerebral malaria will develop epilepsy, meningitis. All these diseases can be vaccinated against. And then, of course, to the public, border injuries are causing a lot of trouble. Where possible, please wear a helmet as you write on this. So, antenatal care, early childhood vaccinations are really important things in preventing epilepsy. And then, of course, appropriate nutrition during especially pregnancy.
Complications during pregnancy, complications that happen during childbirth, infections that happen very, very early in their life. So it can be an infection that the mother had when the baby was in the stomach when she was pregnant, but it could also be an infection that the child got in the early newborn period. So the one people call omusujjagwa omulalama, that is meningitis in English, infection that goes to the brain. It can predispose these children to get epilepsy. People don't know where to go. Our communities, people don't know how to actually identify a seizure or an epilepsy episode. And worse is that we see that some people actually attribute it to witchcraft. And so they do not come to the hospital to seek care early.